Dear friends, welcome to Time with Thebsian on medical devices. The last videos I was talking to you about form A, B, C and D. Today I am going to talk to you about form E. This form has to be filled and supplied by registered hospitals, clinics and suppliers who store medical devices and supply medical devices to hospitals. So naturally, registered medical shops who are storing medical devices and supplying them to patients against prescriptions also have to fill up these forms and submit it. These forms request minimum details about the receipt of the medical devices issued to the patients and the availability of storage conditions as per the direction of the manufacturer, whether the medical device supplied to you is stored in the required temperature or required environment. Then the copy of the prescription of medical devices from the surgeon or the user. Then in this form, manufacturer, supplier and inspection certificate from medical device regulators, that is the drug controllers, if required, has to be supplied. And especially it would be ideal to have a hazard reporting toll-free number of the manufacturer of the device or supplier of the device. The important document related to Form E is the prescription by the surgeon or the medical consultant, and the medical device supplied to the user should have legible records, signed with date, full name and medical registration number. And also it should include the copy of the consent letter signed by the user and the prescribing surgeon. It also should contain to whom it was supplied. That means if the patient is in the hospital has to give the patient ID number and complete address with emergency number to contact the patient or the relatives of the patient. In total, Form E will ask for the data on agents or supplier, the medical devices received and stored and supplied to, and the environmental conditions under which it is stored, and the directives of the manufacturer or the supplier on the storage conditions. There may be a question relating to records of daily temperature, relative humidity of the storage area of medical devices. So naturally, these are the main contents of the Form E. And friends, kindly make sure that you go through all the forms and understand why we require all these forms. Because when a legal requirement is already there, this data should be available with the manufacturer, the importer, the sales agent, the hospitals and medical shops which serve medical devices. But when this is submitted to the Kerala Medical Device Registry, it becomes a document. That is, documents regarding medical devices that is under use in the state of Kerala. So, thank you very much for remaining with me during this discussion. And if you have any questions or doubts, kindly call me or write to me. Then please pass the message of these informative videos to your friends, and do not forget to share this video. Thank you very much.